I am Dr. Azhar Alam, consultant gastrointestinal advanced laparoscopic and laser surgeon. And today I'm going to discuss about a very common as well as a serious issue known as bleeding per rectum or passage of blood in the stools. So right at the outset, I would like to tell that bleeding per rectum is abnormal. This is not a normal condition. It is not a disease, but it is a symptom of a disease. So if any of you notice blood while passage of your stools, it is not a normal condition. It is a serious condition and you need to get it evaluated. What are the types of bleeding per rectum? The blood can be either fresh, bright red in color, which signifies that mostly it is coming from the lower part of your gastro tract, or it could be a little darkish color or a blackish color, which signifies that most likely the source is coming from your upper gastrointestinal tract. What could be the causes of bleeding during passing of stools? We can divide the causes into benign or harmless causes and malignant causes or causes like cancer. So what are the benign causes? The most common causes of bleeding per rectum are piles, fissure, fistula. Then there are conditions known as a polyp inside your anal canal or your rectum. The bleeding could also be because of an ulcer anywhere inside your GI tract. The bleeding can also happen because of other causes known as IBD, diverticular diseases, etc. So these are your benign causes of bleeding per rectum. Amongst the more dangerous or the serious conditions which can cause bleeding are cancers. Any cancer of the gastrointestinal tract can present as bleeding per rectum. So sometimes we are confused that we are at home, we face an episode of bleeding. So initially we try to understand what could be the cause. So let me discuss some symptoms which will likely give you an idea as to what the cause can be. In case the bleeding is because of cancer, we often take the history of is there any change in your bowel habit, any change in the way you pass your stools normally, is there any loss of weight which you have noticed recently, is there any accompanying features like your abdomen is distended, you have loss in appetite. So if you are consistently facing these symptoms, you should take them seriously and consult a specialist. The other group of symptoms are mainly arising out of constipation. So if you have a history of having constipation for a long time, if you have a mass around your anal canal, these could be most likely due to benign causes like piles, fissure, etc. So now we've understood the causes, we've understood what bleeding per rectum is. What do we do about it? So we'll need to get a diagnosis. For diagnosis, you need to visit someone who is a specialist for these disorders. So once you visit your doctor will first do a clinical examination. The clinical examination will include a digital examination, a proctoscopic examination wherein he will pass an instrument through the anal canal to see if there is anything visible. There will be an abdominal examination and he will take all the relevant history. After that, he might prescribe some investigations. Most commonly, the investigations we perform are a colonoscopy and an upper GI endoscopy. So in this, a simple tube is passed through your gastrointestinal tract, which visualizes any abnormality, whether it is a benign or a malignant thing, and then it becomes all the more obvious as to what is causing the bleeding. So treatment. How will we treat a bleeding per rectum issue? The treatment is based on the cause. For malignant cases, we will need a complete evaluation by a multidisciplinary team, and it depends on the stage of the disease, it depends on where the cancer is. But there's nothing to be worried about because today colorectal cancers and other gastrointestinal cancers are very much treatable. We have made major advances in the management of oncological surgeries as well as the medical management of cancers. So you shouldn't get worried about the thing. You need to take a step forward and find out what it is. For benign conditions, whether be it piles, fistula, fissure, or colitis or ulcer disease, there are medicines, there is laser therapy, there is open surgery. So all in all, we have excellent management methods. The point here which should be focused is, if you have a bleeding during passing of stools, please do not ignore it. Consult a doctor, visit him, and find out what is causing it.